7:41 right now. We are seeing a rise in coronavirus cases and hospitalizations across the United States. This morning, we're joined live by Dr. Nannette Funderburk, who can help us learn how to cope with nervous feelings some people might be feeling as we try and make it through this pandemic. Good morning, Dr. Funderburk, and thank you for joining us live this morning. COVID isn't new, so why are we experiencing a reemergence of anxiety and other negative feelings?
You know, I heard someone say once that COVID may come in waves, but the mental fatigue is constant. We have had thoughts of light being at the end of the tunnel at some point, but it just seems like there are more variants and more variants. And, you know, we thought there was light at the end of the tunnel when we finally had enough PPE for everybody. And then when vaccines came, and then when more companies were making vaccines, and then when there were boosters. And so it just feels like the light feels like it's not there, but we feel like we're still being pummeled and pummeled and pummeled. And so that is what is feeding these negative emotions of anxiety and grief and frustration and anger and fear, and they're all balled up into one.
It's just been exhausting, as you just said. So how can we handle something like this?
So, as I always say, you first of all have to acknowledge it. We can't address anything that we don't actually acknowledge. So don't fight that feeling. We also have to remind ourselves that you're still here. You as an individual are still here. And in this environment, that is noteworthy. So then we have to continue to move forward just one step at a time. We can't sometimes we can try to think about doing everything at one time, and we can't try to do that. That's doing too much at once, and that is overwhelming. If you are someone who is working through the grief of an individual or multiple individuals not being here, that's where we have to connect with supports, whether that's family, whether that's friends, whether that's therapy, faith organizations, civic groups, whatever it is. You can't do this by yourself right now. This is not one of those pull yourself up by your own bootstraps moments. We have to connect.
And we know that kids and teens have just been so impacted by this, from remote learning to not being able to see their friends. So how can we help them through this time?
Yeah, with the kids and teens, we definitely still want to help them as well to acknowledge what it is that they're feeling, if it is they're feeling something, and give them the space to actually be able to express. So for the younger kids, they might be a little bit more clingy in these situations, and they might they might act as though they're tired a little bit more, and you know, it seems like their fuse is kind of short. So allow them that time to connect with you. Again, people have to connect with people. So whether that's little people or whether that's big people, we have to connect with people. So the little people might want to connect with you a little more. The teens might need more space, and then have those spurts of expression time. You know, they may be a little more withdrawn, but allow them their space, and then give them time to express in an open and free manner.
All right, Dr. Funderburk, thank you so much for joining us live for this important conversation. We will have this full interview online after the Good Morning Show. We'll be right back.